Hi, my name is Veronica, and this is my reflection in color.
Hi, and welcome to the next episode of Reflections in Color. My name is Edwina Mwane, and I am the founder of Minds Over Melanin. Today, we are joined by a very special guest by the name of Veronica Foster. She is a public health advocate, and she focuses exclusively on fibromyalgia. Welcome, Veronica.
Thank you.
Thanks so much for being here today.
I'm glad to be here.
So, fibromyalgia is considered a chronic health condition that is primarily associated with pain. Although it is very common, it occurs in approximately 3 million people. It's typically not discussed. I believe working with Veronica is my first introduction to this topic, and I wanted her to be here today to kind of discuss it more in length. Right, so let's kind of jump into it.
I'm ready.
So in your own words, how would you describe it? I know I gave a very rough rundown of fibromyalgia, but how would you describe it as a person who is, going through it?
I would describe it as pain that most people they just don't realize how painful it can be, because fibromyalgia it started with me I thought I just had some typical back pain. And then when I noticed that back pain started turning into pain everywhere, I was like, something's not right. It's not right. This pain is, I tell people all the time, I prefer to have a baby natural than to go through this pain daily. Because, having a baby natural, you have the baby, pain goes away. And that's like some severe pain. I did have to have 2 babies natural, so I know firsthand what that's about, but I also know what it's like to live with this pain on a daily basis. Sometimes the pain is dull and ache, and sometimes the pain, you just can't get out of bed.
That was quite the comparison. I don't have any children myself, but I know quite a few people who do, and I've heard that labor and childbirth is excruciating. And so to say you would prefer that compared to kind of what you're going through definitely puts things into perspective. So how does someone get fibromyalgia? Is there
That's the
a cause?
That's the thing about fibromyalgia. They don't know the exact cause. They speculate causes of fibromyalgia, how it starts and when it starts. But I've talked to people that didn't have any of the things that they say. They didn't have a traumatic car accident. They didn't have PTSD. They didn't go through something just so traumatic that their body couldn't handle it. It just started and it's there. They thought it was small things that they had, but when they started and continued to be all over and continuance and on a daily basis, it was like, no, this is not that. To me, they're still trying to figure out where it actually comes from, but they haven't been able to pinpoint the exact thing that starts fibromyalgia.
And that's what I've kind of seen on my end doing the small research that I've done. They associate it or they speculate that it comes primarily from some type of trauma or like continuous compound trauma, like one thing happens after another thing after another thing. But like you kind of said, there's some people who don't have those symptoms. And so I'm kind of wondering, with a lot of ambiguity regarding how a person receives the condition, I can imagine that there's some issue regarding diagnosis and a lot of misdiagnosis. Because when I was looking to it, it appears that it has a lot of overlapping symptoms. with other chronic conditions associated with pain, like lupus, for example.
Yes.
Was that your experience, or you can tell
Yes,
me my
that's
diagnosis experience?
yeah, that's my experience too, because they had to go in, and my doctor, luckily, he wanted to rule out everything possible. So I went through, I don't know how many blood tests, MRIs, CT scans, X-rays, you name it. I've pretty much done it.
Hmm.
And it was all about ruling out this thing, ruling out that thing. So just like a month ago, I just had another test for lupus, just to make sure that it wasn't something that started to happen. Um, then it's not lupus, but the inflammation is so great. Sometimes you just can't believe it, because sometimes I'm swollen, like to the point to where my shoulders look like, I'm a linebacker. Um, because it's hard to say what's what. It's been different.
So one, I think it's great that you had a doctor that wanted to be thorough and really make sure that you received the proper diagnosis. But on the other hand, hearing that you had several tests and blood drawn and maybe x-rays, MRIs, for example, how did that feel to be on the receiving end of that, like being poked and prodded for so many things over a long time?
Frustrating, extremely frustrating, because it was like, why am I going to do all of this? Because every time I go, it's not that. Oh no, it wasn't this. Oh, you have degenerative disc disease in your thoracic area. But I don't think that's what that is either. So let's try this and let's try that. At one point, um, for 6 straight weeks, every other week, I had blood drawn for 6 straight weeks before he got the exact diagnosis, because he wanted to keep ruling out everything that he could possibly think of.
Mhm.
Because when they first started doing this with me, the US wasn't really talking about fibromyalgia. They thought that it was a mental thing for the patients. It
Mhm.
was all about the mental, and nothing about, oh, you're just thinking that, or you're just making that up. That's not true. My doctor actually got with another doctor that had been studying over in London, where fibromyalgia had already been a big thing there. They were already testing patients, giving them medication, and starting different programs with them. And that was back in 2008. When here,
That wasn't too long ago.
right, they still weren't doing much. They weren't doing much of anything, because all the doctors here, that's not what they studied in school. They didn't hear about this, or so they couldn't fathom what a patient was trying to tell them or trying to explain to them what's going on. And I'm thinking to myself, okay, I know I wake up in pain every day. I'm in pain all throughout the day. I go to bed in pain. So this is not something I just made up.
That sounds scary to me. You go to the doctor for answers, and there's no answers. And there like this hope, and every time you come back, well, maybe it's this, maybe it's this. And then even the fear associated with potentially having some of the illnesses that they were testing you for. Like, could I have lupus? That is a very serious, an autoimmune disease.
Right.
With several ramifications, right? And so just to imagine that I could potentially have that, what you're going through emotionally and mentally, in addition to waking up every day in pain and people suggesting that it may be in your head.
Right. Because they just couldn't. And it's harder for people. And I have to say, the people in the African American culture they don't process well when it's something new that has come out. Well, no, back in the day, that didn't happen. Or my mom didn't have that. Or your grandmother didn't have that. they don't, we don't want to think there's something new that is happening, and not understanding that probably you did go through this and you just didn't know what it was. You were made to work through it.
Mhm. Mhm.
Or, oh, she's just, you know, she's having a nervous breakdown. She just thinks this is just all in her head.
Yeah.
And that's hard when you know you're going through it and somebody is looking at you like, no, that's not real. She
Mhm.
just said that.
Mhm.
She's making that up.
Mhm.
That's hard.
And that's a really good point about how medicine develops. And I don't think a lot of people realize that this is an evolving practice. And every
Right.
day, every year, every decade, we're learning more. And what we kind of understand now, like you suggested, we probably didn't understand 10 years ago or 20 years ago.
Right.
And even some disorders or illnesses, the way we categorize them change. We do more research and we're like, you know what, this is not what we thought it was. Let's kind of
Right.
separate these two. Let's make this its own separate category. And of course, the population is not, aware that this is happening in the background. But I think, like you said, that kind of adds into their doubts, like, well, where did this come from? We didn't have that before. And like you said, we probably did, but it was misdiagnosed as something else because that's how we understood it at that time. But
Right.
as technology grows, we get better with things. We get more refined with things. And one thing that kind of comes to my mind is autism. And people are like, well, where did it come from? It wasn't, this diagnosed. We didn't have this many autism cases when I was a kid or my grandparents were a kid. And what a lot of professionals say is we probably did, we just didn't understand it well.
Right.
And we're catching it earlier. Like we have certain measures put into place due to technology and research that, really is able to hone in when it's happening versus, people thinking that's just coming out of nowhere. Um,
Right.
and when we come back to pain, that's not something that can really be measured quantitatively with like research and technology. That's more a self-report. Like you tell me how much pain you're in. And then that takes into a lot of factors like the person's pain tolerance, for
Yes.
example. And so what could be really painful for me may not be as painful for you, but how do we measure that? How do we quantify that? And so I think fibromyalgia really brings that into play as well. Um,
It does.
so when you receive those comments from people like, oh, that's not real, or that's in your head, or that's not in the family, how did you respond?
I used to get really upset. Like, I've always been the stable person, the dependable person that always did everything. And for you to think that it's just in my head, why would I make that up?
Mhm.
Why would I want to say I'm in pain all the time? I'm not an attention person. I don't want all the attention on me. So I'm the last person that would want to make something up to get attention from somebody, because I'd prefer you not to have all the attention on me. So to me, that it hurt my feelings, but it upset me more that you would think that it was made up. So it got to the point to where I just started researching, looking things up, printing things off. Like, I have papers right here from when I printed off a long time ago, and recently from the CDC, from other people around the country, just focusing and talking about fibromyalgia. And what I would do then is I would email it to them, or I would have it all printed out and just hand it to them. This is what I need you to read. This is what I have. This is what I need you to pay attention to. Excuse me. It's not fake. It's very real. And for people to look at you and think something, it's hard, it's hard to phantom, like, what, you really think I would make that up? You don't think that I know myself enough to say I'm in pain, this is real? It's kind of difficult. to live with. And to once that person says that to you, it's hard to get past the fact that they thought that.
That's a good point. Yeah. Sometimes we don't realize that our words have so much power.
Right.
And even though a person may move on, they never forget how you made them feel, right? We never forget that moment. And it's so important to be careful about what we say to people because you can't take it back.
Right.
No matter what you say, no matter how you apologize, that person will always remember what you said, how it made them feel.
Right. And a lot of people that I talk to, I have a particular group that I'm in,
Mhm.
and it was so easy with those ladies. And the funny thing is, we've never met in person. And for the last going on 3 years, I mean, my husband's sometimes like, "Are y'all still up? Are y'all still on that phone?" I mean, we may text at 5 o'clock in the morning and go, I'm getting dressed for work and everything, and I'm still texting, and they're still texting, because I think we found each other by accident on on Instagram, but we formed such a bond because we were all going through the same thing. And people look at you and just think, oh, well, she's got this smile on her face and she's just walking around, she's taking care of business, but you don't know what the pain I feel on the inside.
Mhm.
You don't know what it took for me to get up, to get dressed, and to go on.
Mhm.
Um, and I tell people all the time, it looks like we're fine. We don't want to walk around dragging in a bathrobe all day and just can't go on and can't move around. We look fine. We're not fine.
Right.
We're in pain. But we choose to not let that pain hinder us from the things that we really want to do.
Mhm.
Does it stop us from doing some things that we want to do on a daily basis? Yes. Is it hard on us to go through the day and then at that night we have to take a lot of medication just to lay down and get your body all relaxed? Yes, we do. But we still have life to live, and we still have things that we have to do and we want to do. So looking at us on the outside, you don't see what's going on the inside.
It sounds like you have to wear a mask.
We do. We do. Yeah, it's excuse me. Again, it makes my voice this way too sometimes. Um, we do have to wear a mask, and you have to know who to put it on for and who you don't have to put it on for. Um, I have great friends. Excuse me. We've all been friends for over 25 years. So I don't have to put a mask on for them. They know I'm in pain. They know what I go through, and they don't treat me any different. Um, we go on vacations together. We we raised our kids together. People don't know one kid from the next because they've always been together.
That's it.
So it's hard to distinguish. She looks like you. Is that your kid or is that your kid? They're all our kids. So it's a difference. They're all ours. But I don't have to hide from them. If I'm in pain and we were supposed to go somewhere and I can't go, it doesn't hinder them from going. And they aren't upset that I didn't come. My husband may have went,
Mhm.
but I just didn't go.
Mhm.
Or they may have changed the plans and they come here where I'm comfortable, where I can still be myself and still have a good time with them, but I don't have to go out and try to put on heels or get dressed up or any of those things. I can be comfortable in my own environment.
Yeah. Yeah. So it sounds like support is really key.
and you need a lot of it. And the people that support you, sometimes they need support because they don't know, they have to bear this burden with you. So sometimes they need support as well. They need somebody they can talk to and say, hey, my wife is going through this. She's having a hard time and I don't know how to help her. I don't know what to do. They need support to be able to talk that out too. Because sometimes I know when my husband feels bad, that I'm in so much pain and he can't help me. There's nothing he can do. I can't go buy the groceries, but he can. So, and he knows also how much it frustrates me not to be able to do the things that I'm used to doing.
Yeah.
So it's hard for everybody.
Yeah, that's what it sounds like. Like this is something family will carry.
Yes.
Because you care about this person, you want to help this person because you love them, and you're helpless as well.
Right.
And how do you deal with that and still be present for that person as they need you?
Right. Because fibromyalgia isn't just physical pain, it's mental pain too, because you go through so many different emotions with this. And you think, I didn't think I was going to be going through this in my 20s. I was fine in my 20s and I was able to go and do this. I could get up and go there. I didn't have a pain. 30s come along. I'm still good. I can go here. I can go there. But at the end of those 30s, all of a sudden, wait, I can get up. Because when I first realized something wasn't right, my alarm went off one morning and I physically just could not get up. I was in so much pain and could not just, I'm trying to think like, what is wrong with me? Something's not right. I need a doctor, a hospital, an ambulance. I need something. And I'm waking my husband up like, I physically cannot move. I need to go to the doctor right now, like now.
Yeah.
And luckily my doctor has always been, okay, just come on. Let's try to get this figured out. What happened? Nothing. I went to bed last night. I woke up this morning and can't move. So it wasn't something that gradually came. It's just something that just hit me hard. And when it hit me hard, I was not ready for that. So I was willing to try any and everything that they wanted me to do. I took any medication he prescribed me to take, I would take. Okay, is this going to work? Is this going to happen? Why am I stiff? Why can't I move? What is going on? So the person that's going through it, it's not always oh, these little things happened and I gradually started feeling bad. No, it was just like a slap in the face. Like, oh, hey, I'm here and I'm staying.
Yeah, and that's what I kind of see in my head because your life literally changed overnight.
Right. It did. And it was hard. At that time, too, I had my son and my daughter were both, I had two in elementary school, I had one in elementary school, one going to middle school, one just graduating from high school, going to college. And we were raising my husband's nephew and he was in high school. So it was like, I have 4 kids. I don't have time for this. This isn't it. But once we learned a lot of things, we did have to sit down with them and talk to them and explain to them what was going on. I was super focused on not wanting to miss anything that they did at school. So that was the one thing that I focused on and I tried to do is be there for anything that they had going on at school. I may have had to come back home and get in bed, but I wanted to make sure that I still did all the things that I could do for them.
And how did they adjust? to the changes that you
Um, they they adjusted better than I thought they would. My daughters adjusted fine. They were just like, oh, okay. They had things they were doing. I think it hit the boys more. My son and my nephew, I think it bothered them a lot more than it did the girls.
Mhm.
I think now, in maybe the probably last 5 years or so, it's bothered the girls more, but it hit the boys harder. Things with them. They were the ones here. The girls were off doing things
Okay.
that they needed to do.
So it's
So,
more of the day-to-day
yeah,
experience, and they're closer to it.
yes,
Oh, man.
yes.
So I want to take the time to read the CDC definition of fibromyalgia.
Yeah.
I knew I was going to mess it up at some point. Because I think as we discussed it, there may be some confusion that people have. Like, well, what is it? What is
Yeah,
it? And so I really want to read it because we're focusing on pain and that's what it's about. But I don't think, if you're familiar with it, it's really hard to make the connection.
right.
Most people are like, the pain comes from somewhere, right?
Mm-hmm.
Or you're dealing with something else and the pain is the side effects. When the disease, this is a disease, just pain.
Right.
And so fibromyalgia is a condition that causes widespread pain all over the body in tender points that are sensitive to the touch. It is not considered a mental illness, but many people with fibromyalgia also experience depression and or anxiety. In fact, patients with fibromyalgia are 3 times more likely to suffer from depression than the general population. Um, so it's just pain,
It's just pain.
just all over your body, sensitive to touch. So that
Yes.
means it may be hard for you to even sit at times or lay at times,
Yes.
you
At
know,
one point,
close to another person.
right. At one point, I was like, I think I'm gonna get bed sores from laying in the bed so much because you just don't want to move
Mhm.
because everything hurts. I told my husband one day, I said, I think my fingernails hurt. It hurts to blink, everything. If I lay down and I want to get rest, I have probably about 10 pillows. Sometimes I take mine, I take his, I try to pile them up real close to me because you want the softest thing around you. So sometimes even the clothes that you have on, it just feels like, oh my God, I got to take this off. These clothes hurt. Everything hurts. I've never felt like that ever till I had fibromyalgia. It literally feels like sometimes he'll touch me or they'll rub something will rub against me and it's like that shouldn't hurt.
Mhm.
It really shouldn't, but it does. Don't do that. Stop, because it's hard to imagine that your skin hurts.
Yeah.
But everywhere that you have a nerve or muscle, it all hurts.
Mhm.
You know how you want to bend your knees to pick something up? They always say, bend your knees. Don't do that. Don't. Yeah, bending your knees is kind of hard because later on, if I bend my knees just a couple of times picking something up or going in a cabinet or doing something, later on, I might pay for that. My legs may be hurting or burning and I didn't do anything but go in the cabinet or pick something up off the floor and it's like, oh, I can't really stand back up right now. That was hard.
When I think of that, just envisioning you or another person just trying to live, um, and to know that they don't know how this happened.
And we don't.
We don't know if it's genetic, we don't know if it's environmental, we don't know. Well, we know it's not mental, um,
Right.
But to know that this just appeared and is not going anywhere. And this is my life every day, a life of discomfort. And I think of a time where I had a lot of pain from a car accident and I hurt my neck severely.
Mhm.
And I tell people, I'm like, you don't realize how much work your neck does until it stops working. And I was in so much pain. I was so frustrated all the time and I was crying all the time because I just felt so helpless. And that was just one part of my body that was in the process of healing. This is your whole body that this is going to be for the rest of your life. How do you cope with that?
Um, it's hard. It really is hard. I've had to learn that this is my life.
Mm-hmm.
This is what it is, what it's going to be. Is it hard to think about that on a daily basis? Yes. It was harder when I first found out that I was going to have this and I was going to have to deal with this. I didn't fathom that it was going to be really this long. I
Mm-hmm.
did not think that, yeah, you're really going to have to deal with this. I kept thinking, oh, this is going to go away. I'm going to get this miracle drug and I'm going to feel fine. It'll go away in 5 years. No, that was in 2008 and this is 2020. So it hasn't gone anywhere. It's still here. It still works on every nerve I have, literally. But I do get frustrated when it's something that I really want to do, that I really want to participate in, and I can't. It's mentally challenging and hard to think that you can't make long-term plans for something because you have to make a backup plan for that plan just in case I have a flare and I can't participate the way I wanted to. Flares, I have had them to where they last a day, and I've had flares where they last weeks or a month. They come, they go, but you still have that dull, aching pain every day.
Mm-hmm.
That type of pain you can get through. You can take the medicine that's prescribed for you and you can get through those days. The days that are hard, even with the medication that you take, is when you have a flare. And that flare can take you to a whole different world. You're depressed. Your mind is just like, why? I can't get up. I can't move. I have friends that say, do you ever get that feeling like you feel like you have the flu all over your body? I've had those times, but I don't feel like that. The pain that I have is I just can't move. I just don't want to move. I don't want to get up and walk. My doctor said, okay, one day in the bed, you stay there, you rest. Tomorrow, stay in bed, but I want you to get up and I want you to walk around and do something. My husband believes in those days because he'll call me and say, have you gotten out of bed? No. At least go out and check the mail and walk back in. Okay, I can do that. Sometimes I can go out there and walk the sidewalk, come back in. Some days I don't want to do that. I don't want to move. This morning I thought, okay, I'm in so much pain. Am I going to be able to do this? And that was at 6 o'clock this morning. I went into my living room. I got on the couch, sat there for a while, came back in, and I said, no matter what, I'm doing this. I can sit here, I can do this, I can get in bed later. Sometimes it could be where the flare is so bad, I'll say, oh, I cannot even think straight to talk to somebody because I don't know what I may say.
Mm-hmm. Yeah.
Those days are hard. Those are really hard days. And so many people still don't understand what that's like. I tell people sometimes I need you to go out and just get you like 10 bricks. You're going to put 5 on the other shoulder. Tell me how long you can walk around like that. Go through your day and do everything you have to do like that. That's what it feels like sometimes. It's heavy, your body hurts, and you just can't, you know you can't move with those bricks on your shoulders.
Yeah, it feels like a pressure.
Yes.
Okay.
And that's what it's like. It's hard.
Does it ever feel piercing at times, or is that more so associated with the flare-ups?
It just depends. Some days you can get that piercing pain. For me, piercing pain for me is always first thing in the morning or after I've had a full day and taken my shower and it's time to relax.
Mm-hmm.
That pain may hit you hard because of what you've done all day. You still have to live life. You still have to do things that you have to do. And it's people that have to go to work every day. I'm at a point in our lives, I don't have to go to work every day, but I choose to go to work every day because if I stayed home, I'd go crazy because I wouldn't have anything to distract me from the pain.
Exactly.
And I would just live in that pain all day. So I feel like going to work mentally saves me.
Mm-hmm. Mm-hmm. Absolutely.
Is work sometimes a different type of mental challenge? Yes. But I have fun at work. I enjoy it. And it saves me from myself. And that's something that I think everyone with fibromyalgia, they need that where they can just go somewhere and do something, or they have something they can actually focus on. Because otherwise your focus is always your pain.
Mm-hmm.
And mentally that beats you up daily.
So going to work, well, I'm not sure if you're going in during COVID times, but do you communicate what's going on with you health-wise to your employer? Or is that something you really try to navigate and maintain yourself?
No, I'm honest with them. I'm always honest with them. And um, they tend to, the ladies that work up under me and my principal, they all check on me and make sure I'm good, make sure I'm okay. Especially the ladies that work under me, sometimes I have to tell them, okay, that's enough, go away. Are you okay? Should you be getting that? Do you need to pick that up? Do you want us to go? It's okay. It's okay. It weighs like 2 pounds. I can pack up paper back to my office. It's okay. But they're good. And the days that I have to work from home, I do. It's not an issue. It's not ever been a problem. So it actually works out. And I work literally from my front door to my school is 4 minutes. So I'm lucky to be that close to work.
Yeah, that's good. So did you have this job before you were diagnosed, or was it a new job afterwards?
No, I had it when I was diagnosed. So I've been there 14, 15 years almost. So it's it's been it's been there.
Everything on this journey. Okay.
Yes.
So as you were speaking, I was kind of hearing some of the things that have been helpful for you to, navigate and cope with your new circumstances. And so one of them is just having support. Like you mentioned, it sounds like a support group with other like women.
Yes. I love them.
Close
They're
every time you mention
yeah. Yeah, they are
them.
something else.
So having people who
It's,
really
and
understand,
it's
I think is powerful.
Yeah. And then our friends, they've always been there to support me and help me. And my husband is the biggest supporter of what I have. Um, he's been there for every MRI, CT scan, days I could not move. So he supports me 100%, and he tries his best to help get me through those days that I feel like I can't get through those days.
Absolutely. That's what support is for.
Yes.
Everything on our own.
Yeah. And my kids are good supporters too. My son sometimes is too much, like, okay, go away, I'm fine. And my granddaughter, she's 9. And oh my God, you would think she was the doctor, the nurse, and everything. Because I see a neurologist in Houston, and she's always, do you need me just to go with you so we can talk about this? No, ma'am. I don't need you to go with me so we can talk about this. Well, I don't think you should have been up doing that. Just let me come over and help you. I was like, oh my gosh, she is too much.
Yeah. But it's nice. It's better to have than not have.
Yes,
And tell them to back up. That's good too. So you're not asking for more because they're giving you everything, and you're like, we can scale it back a little bit. I think
yes, yes,
and then you also mentioned just movement. So when I work with my patients who have chronic pain, we talk about movement a lot, and we say motion is lotion for your joints.
yes. It is.
Movement. It
It
just
actually is. Yeah, because the more you move, the less stiff you are.
Mhm.
And, it's the days that you can't move. You have those days, but the days that you can, move as much as you possibly can because it helps.
Mhm.
It does help.
Yeah. Walking to the mailbox. I love that. Just walk to the mailbox,
Yeah,
right? Or just walk to the living room, get a glass of water.
yeah,
Anything. And pacing yourself. I discuss pacing with my patients. Like maybe just walk around the living room. Like start small. It doesn't have to be we go walk to the track and walk
right,
2 miles.
right.
Just little by little, just get in the mood of like just moving your body. Because like you said, immobility makes you stiff.
Yes, it does.
And although it's really uncomfortable, it's really important to do something, to move something, to get the body back into rhythm. Um, and then also having something to distract you.
Yes,
Have your job. You have something that challenges you, pulls you away from your pain at times.
yes.
And people can say like, "Oh, that's stressful," but life is stressful, unfortunately.
Right. It is. It is.
But that's one of the beautiful parts is sometimes we're doing things we really love, and stress doesn't always have to be a bad thing, it's us doing
Right.
something, challenging ourselves and feeling a sense of accomplishment of that. And I
Yeah.
can imagine for you, knowing that this was a rough day for me, but I was able to make it through the day at work is a win. And you feel
Yes, it is. It is. And I've had those days. It started out rough when I got up that morning, and I just choose to say, okay, is this a day that I really need to stay at home? Or is this a day that I really need to try to get up?
Mhm.
And sometimes I just choose to get up and go, because once I get there, I see the kids, I see the staff. So it helps.
Mhm.
It helps you not beat yourself up because of what's going on inside.
Yeah.
And sometimes you need to just get out.
Mhm.
It's those days it's hard, but those are a lot of days that you can just get up, just move, and just be with the people that you love to be with.
Mhm. Mhm. Yeah, it's really important to have things outside of the home.
Yes.
Because when you are secured only to the household, you're consumed with your thoughts. You're
Yes.
consumed with the pain.
Yes.
And we'll also add to that, you'll be more consumed with depression because of the loss of your life, you know,
Yes.
and I guess that kind of goes into my next question. Um,
Yeah.
Grieving the life you had, because you said I had to accept this is my life now, right?
Mm-hmm.
And you had a life before this, and that
Yes.
life doesn't exist anymore. And there's some grief associated with that. Like you have to mourn that loss.
Yeah.
How was that process for you?
It was really hard. It was rough because I didn't want to give up and say, I can't do that.
Mhm.
I can't do that anymore. I used to bake cakes for weddings and birthdays and all that. And that was something that I had to stop for a while and not do because I would be in so much pain by the time I was done. I couldn't be happy for the person that I made it for. I couldn't enjoy them being happy about it. So I had to stop and scale it all the way back. Do I still do that? Sometimes for certain people, yes. I don't do anything big and grand, but there's certain people that will ask me to make a cake or do cupcakes or something, and I love doing that. So yes, I'll do that. I try not to commit myself to anything that's going to take days. It has to be something small that I can do in a day. But I had to stop it for a while, but then gradually go back to it. So that is still, I'm still focusing on something that I like to do.
Mhm. Mhm.
So sometimes you have to give things up to get it back. But with the question, giving up things, that was the hardest thing. And I went through a whole list in my head of things. I'm not going to be able to do this. I'm not going to be able to fly. I'm not going to be able to go on vacation. And my husband was like, wait, you don't have to stop those things. But I can't fly. If I want to go to Hawaii, I have to really think about that. That's a long flight. I'm not sure that's a flight that I can take. So we put that back on the back burner for a while because that's what I wanted to do when I turned 50 was go to Hawaii. And I'll be 50 in 2 months. But I'm like, I don't think I'll be going to Hawaii, first because of COVID, and second because if I'm on that long flight, I'm gonna have to have a whole day or two just to get my body together to enjoy that. So that's something that I had to think about. But I can go on vacation, I can fly. I just have to prepare myself for those things.
Mhm.
And I do. Um, then my son played football, I was able to do that. I mean, watching my granddaughter's dance recitals and going on vacation with our friends, and I can still do those things. But at the time, I felt like I was going to have to give up everything because that's how you feel. It literally takes still some of the things that you like to do. There's a lot of people that goes, oh, well, I still do this and I still do that. Well, how do you feel later? So was it worth it? Lady Gaga has fibromyalgia, and she's talked about having to cancel concerts because she couldn't function. She canceled her concerts because she had to get her body back in shape, had to get well. She couldn't move, she couldn't function. Morgan Freeman has fibromyalgia. And he stated that he only has one life to live and he doesn't want fibromyalgia to take that away from him. And I agree. I only have this one life to live, so I don't want fibromyalgia to steal all the joy away from me.
Yeah.
Because it could.
I like what you said earlier about pausing certain things, not eliminating them.
Mm-hmm.
You know, and I think when people are presented with, you know, similar health situations as you, they kind of feel like I can't do anything anymore. And that's where a lot of that depression comes, or just adjusting to the changes that you have to make.
Yeah.
But I'm really happy to hear that you're like, I'm just prioritizing now more so. You know,
Yeah.
like I still love to bake and I do bake, but I'm not baking as much. And so you still get to keep a piece of it versus losing everything. And I think in the scheme of that, that's important to keep something, you know, because there are some changes. Can't, you know, cater a whole event anymore. It has to be private parties or just a small gift to someone. But that can be hard too, especially if you're a person who really loves to get up and go, do a lot of things, and be a busybody. It's an adjustment. It's an adjustment.
Right. I can't. I used to love to go to a grocery store. I'm there at 7 o'clock getting everything I need because I still have a whole ton of things I'm gonna do for the day. But no, I don't do that anymore. Actually, I was so happy when ordering groceries came out and you just go pick them up. I was like, that is my new jam, is to get those groceries ordered. Because getting up at 7 and doing all my running around and still having the rest of the day to do different things, that doesn't happen so much.
Yeah. So life looks a little different.
It does,
So
but it's not over.
it's not. It's not. And when I was looking at fibromyalgia, one thing they brought up was fibro fog. And that is another common symptom of fibromyalgia, where it's like mental haziness. So, you know, your concentration is off, you can't remember things. And you get depressed because of that, because someone will say, I just talked to you about this yesterday. And you're like,
Oh,
we don't know, you know?
mhm.
And you kind of feel incompetent at times. And it's not, it
Yeah.
looks like that's something that you've kind of had to deal with.
Oh, yeah. Believe me, my desk at work has like a ton of sticky notes everywhere because I take, just in case I forget this, let me jot this down. So I have like sticky notes all over the place on my desk. And the hardest thing is when you're talking to somebody and you're in this whole conversation and you've been going and going, and all of a sudden you just stop because you don't know what you were just talking about. You don't know what you were about to say.
Mhm.
And it's just like, what? And sometimes people look at you, it's like, okay, don't look at me like I'm crazy, but okay, can you repeat that? What were we just saying? Say that again. Because so it'll trigger it. I need that to come back. Like, what? What was that? The hardest thing, it's extremely hard for my husband for me to have fibrophobia because he's always depended on me for phone numbers and remembering numbers and all that kind of stuff because I can tell him, right, I can give him the number right now and it'll be like, okay, what was that number I just told you? No idea. But now it's hard for me because he's like, I'm depending on you for the number. Now you're gonna have to write all this stuff down so I can have it. I was like, I know. I have to remember to write it down so you can have it. So,
Yeah.
but you do go through that. It's there. It is there. It is hard. But it doesn't stay for a long time for me I know people that it does, but for me, I find it more for short-term memory that I forget what I'm doing or what I'm talking about, but not so much long-term.
Okay.
The other thing that fibromyalgia does is tingling, numbness.
Mm.
Uh, a lot of people don't know that they have restless leg syndrome.
Mm.
And that's something else that you have to get tested for by the neurologist. But oh my God, that was when that started is when I thought like, what am I going crazy? Or is something crawling up my leg? I thought it was under my skin. I thought like, what the heck is this? And that's when I found that out that I had restless leg. But as soon as he gave me medication for that, it stopped right away. But that was kind of a creepy feeling to me of having that. And then you can have pain in your jaw. And that I do end up having sometime is the pain in my jaw. Um, it just depends. It doesn't last too long, but I've noticed like if I put a warm compress there or something, it'll start to ease up and go away. It's just different things that it affects in your body. You could have IBS, the irritable bowel syndrome, bloating, constipation. It affects different things that have to be treated along with the fibromyalgia pain.
It kind of acts like an autoimmune disorder,
Yes,
but it's not
it
considered.
does.
Is that correct?
Right, correct. So it does act like one, but they haven't actually said it was one, but it does act as though it is one because of all the different things that it affects.
Yeah, on the body.
Yeah.
So looking at fibromyalgia, there's three forms of treatment that are recommended. The first one is self-care. The second one is therapies, and the third one is medication.
Hmm.
So you kind of mentioned that you take the medication for like the restless legs, the pain. What are you doing for the self-care aspect or the therapies aspect?
For self-care, I do have to take the time for myself mentally because I try so hard to do things that won't cause me to have a flare. So I'm real conscious of the things that I do and how I do them. I try to uh, get massages. Sometimes that's hard, and you have to make sure that they know that you have fibromyalgia because it could be something that hurts you as well.
I can imagine.
But,
Yeah.
but getting a massage is a great experience. Um, I sometimes have to rest a lot.
Mhm.
Um, for myself, mentally and physically, I have to rest. I don't do therapies anymore as far as physical therapy because I was normally in more pain when I was done with physical therapy than when I went. So I did try to do the physical therapy, but that was just too painful for me to go through. And I had flares after that. So that just didn't work for me. Um, an Epsom salt bath works a lot for me to help pull out some of that tension and it relaxes the muscles a lot of time. So I do try to do that a lot. I had to cut out certain things that I eat um, because I went through a whole thing to figure out what triggered certain flares that I had. So I had to cut out a lot of foods that I eat. I don't eat pork for whatever reason. Anything I eat with pork in it, I have a flare. I don't eat a lot of wheat, anything with wheat in it, or I don't function well with that. And I don't function well with a lot of pasta anymore. So I don't eat pastas. And I love pasta. So that's hard. But it's certain little things that I have to do to make sure that I'm good. And that's what I focus on the most. And a lot of people with fibromyalgia don't know, or they haven't went through it yet, is, and I hate the dentist, but the dentist is a major thing that they need to keep going to do, because you can get the TMJ in your jaws, but a lot of people with fibromyalgia also tend to grind their teeth, grit their teeth from pain, and that wears on your teeth.
That's correct.
And causes more pain. And sometimes they don't understand, why is my face hurting? And sometimes that's the cause of the pain for your face.
Wow.
Is that, so going to the dentist is a big thing, is to keep up with that.
Okay. And don't do physical therapy. What about mental therapy? Have you ever done that before?
Yes, I have. I've gone to see a psychiatrist before. And she tended to want to give me some medication, and I was like, I don't need that type of medication. I just need somebody to talk to. So I switched to a psychologist, and I love talking to her. She helps a lot. She really does help a lot. She's about to retire, so I was like, okay, what am I gonna do now? It's gonna have to be find me I have to find me somebody on Zoom to talk to or something. So, but yeah, that part for me is needed, because you have to express to somebody how you feel. You don't always want to burden your family with that. They're already dealing with the pain side of it, but you don't want to burden them with the mental side of it. So you have to talk to somebody. And going back to my ladies group, we tend to be each other's therapist, because we can talk about this with each other, because we all understand it, and we all understand how each other feels. So us getting together and talking and texting has worked wonders to get out the emotional part and the mental part of how you actually feel about things. And I tell people all the time, when the doctor first told me, get into a support group. There are support groups where they meet online. Where I am, there is a support group, but it's not really close to where I am. And they tend to not look like me. So it's hard, because everybody's different. The ladies in our group, they all don't look like me, but we all are around this, closer, around the same age, and we understand each other and what we want to do with our families, so to speak. So that's very helpful to be able to talk to somebody.
Absolutely, at all levels, and it's unfortunate because there isn't a real treatment for this. It's more so maintenance, pain management, if anything. And that can be really frustrating too.
Yes.
But they said that movement, self-care, like you said, making time for yourself, understanding you have limitations and working within that.
Yes.
Instead of just kind of taking it as, I can't do anything, like, no, I can, but I just have to be careful about how I do it, when I do it, etc.
Yes.
Those can really help you still live the full life that you deserve to have.
Yes.
And then the therapies, physical therapy, that kind of makes sense. But yeah, having someone to talk to, someone who is unbiased. That is the best thing about therapy. Someone who is unbiased, someone who doesn't know anything about you, right? And they hold all your secrets.
Yes.
And there's some things we don't feel comfortable telling our family. As much as we love them, as supportive as they are, we want our own privacy.
Right.
And that's what a therapist is there for, as a person who's not going to tell anyone, they're not going to judge you, and they're there to support you and to help you figure things out.
Yes.
And of
Yes.
course, the medication.
Yeah.
Um, I know there's some people whom I've spoken to who are very hesitant to take their pain management medication for fear of addictions. Do you feel that way?
Uh, I felt that way on one medication that he put me on, um, because it made me feel so different. I knew right away I didn't want to keep taking that. And then I felt like when I was taking that, that I felt like I was a little crazy. You know, it just like I'm taking this medicine, but I feel like I'm not quite right.
Mhm.
And something right away told me, okay, you need to stop taking this. So
Okay.
I kind of like just stopped it on my own and just didn't take it, and then let the doctor know, hey, I don't think I want that.
Yeah.
I don't want to take that. Give me something else.
Listen to your body.
Right. And then the one medication that they gave me that I thought, oh my God, this is a miracle drug, because I felt good and I was like, ooh, I can go and do this, I can go and do that.
Mhm.
I think I took it for like 2 days. And that third day, that morning, I looked like somebody had blew me up. Everything was swollen. I couldn't put my shoes on, my hands were swollen, everything. And I was like, ooh, what happened? So I end up pulling out I always keep the little paperwork to say what side effects are. I'm like reading like, okay, what is this? What is this? Oh my God. I called the doctor and he was like, okay, you stop that right now. Don't
Oh,
take it anymore. You can't take that. I was like, what? I was feeling good on this. But nope, that did not work out for me.
yeah, that's the hard part is finding the right mix, the right dosage, for
It
what
is.
you need. Um, but it sounds like you have a phenomenal relationship with your health provider. And this is someone you feel comfortable speaking with, letting him know what you want, and also someone who listens
Yes.
and is very thorough. And even though it's not fun to be poked and prodded, but knowing that someone's like, I want to make sure that we're going in the right direction to the best of our ability.
Right.
Yeah.
Right. And that's what I do have that. I try to, once I feel like the doctor isn't listening to me and is just telling me stuff and putting me on this medication and that medication,
Mhm.
I don't want you anymore. I don't want you to be my physician, because this is all about you. It's not about me. It's just about what you want to do, and you're not listening to how I feel.
Mhm. Mhm.
Because I will, yeah, I'll cut a doctor off in a heartbeat. Like,
Good.
no.
I mean,
Um,
be an advocate for yourself.
you have to be.
Medical field, especially as a Black woman, and all of the barriers we face,
Right.
all the disparities in our health outcomes, especially mortality rates. It's really important to speak up for yourself
You have
and
to.
understand that you're trusting this person with your life, literally.
Yeah.
And if you don't feel comfortable with them, you have the right to leave and find someone else. There's a lot of doctors.
Yes.
And I think, especially for fibromyalgia, um, that's important given the complexities of the disease.
Yes.
Given the complexities, that is really difficult to see pain, as we discussed earlier. Like occasionally you may see the inflammation and the swelling.
Right.
It sounds like that's more flare-ups that come and go versus the consistent pain that no one can see.
Right.
You want to have someone who is empathetic and responsive to what your needs are.
hmm The hardest thing is for somebody to tell you, oh, you don't look like you're sick. You don't look like you're in pain. Okay, well, what does that look like?
Yeah,
Because it can look like something different for everybody.
absolutely.
And what you see on the outside is not what you see on the inside.
Absolutely.
And you have to know your body,
Yep.
and you have to have the right doctor to know that they're going to work for you. They're going to help you. I tend not to want to see older physicians because they're kind of like set in their ways, and they don't tend to want to change. So I try not to see, and there's nothing against them. I love them for my kids as pediatric doctors, but not for me.
Yeah. 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 Like you said, you have to find the right match. And
Right.
I think definitely with this disorder, it is better to have a clinician who's more flexible.
Yes.
We're still learning more about it and someone who's interested in learning as well. Because, like you said, it wasn't really discussed, for the past not even 20 years.
Right.
So this will require a physician who's very curious
Mm-hmm.
and has the energy to do work behind the scenes, not just when they're in the room with you.
Right. Right. And sometimes you need them just to want to explore
Mm-hmm.
other possibilities of treatment. So my doctors are real good. If I look up something and be like, okay, hey, I read this. Do you think this will work for me? I don't always want somebody that's going to say, oh, no, you can't do that. I want somebody that will let me look at it, let me research and get some information on it, and then I'll let you know.
Yeah.
And I have that with my doctors. They listen to me, but they tend to say, okay, get off the internet.
There's always a balance. You have to have
Right.
like I always do this one. I'm like, girl, let's leave that alone.
Right. Yeah. I've had them tell me, get off the internet. No. Mm-mm.
Okay, Veronica, thank you so much for your time. I just want to do a quick review of all the takeaways of the gems we discussed today.
Okay.
So the first one is kind of your coping skills. So we talked about motion is the lotion, like getting
Yeah.
up, trying to move, as much as you can.
Yes.
You also talked about having a support system has been really helpful for you. And that involves being transparent with the people around you, right?
Yes.
We can't have people support us if they don't know what we're going through.
And you have to be able to explain to them how you feel,
Mhm.
and you need them to listen.
Absolutely. Absolutely. Yeah. And accepting help.
Yes.
That's a
That
hard
was
part.
hard at first.
Yeah.
That was hard at first.
Yeah.
I'll admit, but it's great now.
Yeah. Accepting help, being open and honest, vulnerable. Vulnerability is something we all struggle with.
Yes.
I think fibromyalgia, myalgia, fibromyalgia brings that out. And so it's nice to have that. And then also seeking out, a support system of
Yes.
like people because family is family.
Yes.
And I always say everyone has their role in your life. Everyone can't be everything for us. And so your husband can be the best husband he can be, but he can't be your friend. That's what your friends are for, your
Right.
girlfriends, right? And they're great in their arena. And then
Right.
you have people who are, co-diagnoses, and they really get it. And then they're really well in their role. And so knowing that you don't have to take one group of people and spread them out. Like they could just be great in their pocket. Like you're going to be a
Yes.
great son, you'll be a great daughter, great nephew, et cetera, et cetera, et cetera. And, kind of reaching out and recognizing that this is going to be like a group effort. And I can have people for different needs.
Yes. That's exactly true.
Mhm.
That's right.
And then we also talked about prioritizing versus eliminating, which I love. I take that approach with dieting.
Yeah.
I
Yeah.
try to eliminate stuff like pasta, and
Yeah.
that just doesn't work. And so just scale
Right.
back, and you can have a little bit. You can't have as much as you want, but that's better than nothing at all.
That's true. And then I needed to be able to get back to that
Mhm.
because that was something that actually hurt me to lose. So I'm glad I was able to eliminate it for a little while, but get it back just a little bit,
Mhm.
and not all the time, but just enough to satisfy that creative side of you.
Absolutely. Even the vacations, just planning better. You know,
Yes,
we may not have the capacity to get up and go like we used to, and we have to have a plan A and a plan B, and
yes,
sometimes a plan C.
exactly.
Um, but if it still means that you're going to accomplish what you want to accomplish, you just have to take a different route. It still works out in the end.
Yes, it does.
Mhm. And you said being an advocate for your health, that's important, especially something like, fibromyalgia. uh,
Yes,
is, speaking up for yourself, being assertive in the patient room, and talking about your options. So like you do, like, I read this, what is this about?
right.
And recognizing that if you don't have that trusting relationship with your health provider, you need to go somewhere else.
Yes, and I'm a big patient advocate, and I want more people to be that for themselves. Everything the doctor says isn't just the end.
Mhm.
There are other options, and if you trust him or her, then you should be able to discuss what it is that you need with them. And then if they don't see it your way or don't want to help, go somewhere else. Go to somebody that will.
Absolutely. Absolutely. It's just as simple as that, in all honesty.
Yes.
So thank you again for your time, Veronica. Where can we find you? Mm.
You can find me on Instagram right now under VF Sweets, and I'm on Pinterest as Ronnie Rose Boutique.
Wonderful. Thank you. Thank you.
And I will, oh, thank you. And when I get my blog up and going, I will send that to you.
Absolutely. Keep me updated, and I'll be
I will.
happy. I
I
thank
will.
you again. Thank you again, especially knowing that today was not an easy day for you. And you still mustered up and came on to talk about this and bring more awareness to it. I
Yeah.
really appreciate your time today.
Thank you. Thank you for having me.